Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Aboelata from Roots Community Health Center, reporting for the week of August 14th, 2023. Today, I'm going to provide a detailed update and perspective on the state of the pandemic. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. So I've been reviewing for several weeks now that we are at the point in the pandemic where we have to rely on multiple different sources and indicators to get a sense of where we are. And the best indicators at this point, in my opinion, seem to be wastewater, percent of test positivity, emergency department visits, and these are all three somewhat earlier indicators. And hospitalization is a lagging indicator, and I will call death a late indicator. Also, variant proportions and genetic sequencing can provide us some clues about the state of the pandemic as well. So I will walk through each one of these. First, taking a look at wastewater. This graph is showing the percentage of wastewater sites across the United States that have increases. Those are in orange, and large increases, those are in red. The yellow is stable and the blues indicate decreases. And the black line tells you how many sites are reporting. These data are through August 7th, with the caveat that those 2 weeks shown in the shaded area are still incomplete. So our complete data is really 3 weeks old, but you can see here that basically since early June, the percentage of sites that are seeing increases, that's in the orange and the red, are on the rise. And if you kind of look at that blue area, further out to the right that you go, the smaller that blue area gets. And again, the blue refers to decreasing. So this is all kind of heading in the wrong direction. And if this is something you're interested in knowing about for your area, or maybe even an area that you might be traveling to, I'd encourage you to find a sewer shed reporting near the area of interest. I've linked a few wastewater resources in the post, and here's an example from the Verily Wastewater website. So this is taking a look at the last 90 days in Oakland, California at SARS-CoV-2, so we can definitely see it is increasing. And one thing I like about the Verily dashboard is that you can take a look at other viruses like flu A, which we see is flat, flu B, also flat, RSV, flat, and human metapneumovirus. So the other respiratory viruses that are being tracked are not being detected at this time, where SARS-CoV-2 is continuing to increase. So just to reiterate, right now, we're not seeing flu A or B here locally, or pretty much across the United States. We're seeing very, very little. Flu season ended in May. You could have some stragglers in June, or people may be bringing flu in from other places, but we're really just not seeing flu activity right now as completely expected and normal for flu. In fact, I've had some outreach from reporters recently to talk about whether we're seeing some kind of a summer flu, because that seems to be a bit of a narrative that's been going around. And I've linked one of the articles in the post, and basically, no, it's not flu. It's much more likely to be COVID, and testing would be important for all the reasons that we've gone over here many times. And so it's pretty clear that we're not seeing flu right now. Having said that, here in the Northern Hemisphere, flu season will pick back up soon in October. So that's really right around the corner. So we will be looking for an updated flu vaccine around that time. So what we're seeing here is what's called combined seroprevalence. So that means you add the people who've gotten vaccinated plus the people who've gotten COVID, and we're at 96.7% of the population having some kind of protection from either prior infection or vaccine. But if you want to know about people who just had the infection, you check infection-induced seroprevalence here, and you can see that we're down to 77.5% of people that have evidence of a prior SARS-CoV-2 infection. And we can see that it is lower in some states like Oregon and California and Vermont and a few others where it's 70% or even lower than that. And quickly back to wastewater, I do remain hopeful about the use of wastewater and our wastewater infrastructure in the field of public health. I think it is going to probably or could be one of the main ways that we track the pandemic, especially because it doesn't rely on anyone's behavior, not on people getting tested or healthcare providers offering testing. Also, we can use this for a lot more than just detecting SARS-CoV-2. For instance, this is actually how we got our arms around what was going on with polio in New York last year. And as I've just showed, we can take a look at a number of different respiratory pathogens to get an idea of what's circulating. One of the most interesting applications to me is the fact that we can actually sequence the wastewater to see if there are new variants that are coming and that we might need to keep an eye on. And that's another way we can start to get a better handle on how things are moving before they may arrive in one area or another. I still don't think we're quite there yet as to having a cohesive or comprehensive system like I'm sure we could. But we are seeing more wastewater sites popping up, and I think just in general, more acceptance of this infrastructure as an important piece of the puzzle. And if this is something that interests you, there's an excellent webinar that was done by Professor Marc Johnson, and it's on the People CDC YouTube channel. It's about an hour and a half. It's very, very informative. There's some interesting stories there, even about how they were able to track the movement and the spread of the Delta variant, and how most recently they identified someone that was apparently carrying a chronic infection, and all of this coming from wastewater. And I've linked that webinar in the post. And taking a look at test positivity, we can see that looking at the last 4 weeks, the majority of the country was less than 5% positive. And when we look, except for this small part here in region 3, we look at the last 2 weeks, we have region 6 here in the 10 to 14.9% positivity range. And looking just in the past week, we can see that pretty much the entire Southwest is over 10% positive, with region 6 here being 15 to 19.9% positive. So taking a look at this another way, we can see that percent positivity across the nation as a whole is continuing to head up. It's currently at 10.6% positivity on average, and we're still in the range of about 30 to 40,000 tests being conducted each week. So not a huge number of tests, but that number has actually been fairly stable in terms of the total number of tests being conducted for the past couple of months. And this is actually one of the reasons why I think that this is still a valuable metric for us to be looking at moving forward, because barring any big change in testing behavior, the direction of this metric will tell us if we're headed in the right direction or the wrong direction, especially when we take it in conjunction with wastewater and emergency department visits and so on. And this data is taking us through August 5th, although the last couple of weeks are also still incomplete here and will continue to be updated. Now, this graph is the same one I just showed, with the orange line representing weekly percent positivity. And the blue bars here are showing new hospital admissions, again, with those last couple of weeks still being updated. So, and we know that hospitalizations are actually incomplete because not everywhere is reporting. But we can see that throughout the pandemic, the shape of these waves has stayed fairly consistent. What we'd ideally like to see is that whether cases are going up or down, that hospitalizations stay low and flat. And we're obviously not quite there yet. We can see that new hospitalizations are increasing. Hopefully what we're seeing is that they're not increasing quite as sharply as cases, but we have still not gotten to that place of decoupling, which is where we want to get, meaning that we'd like to see these things not related. We'd rather see that cases go up without any change in hospitalization, because that would mean that we have much better control of the situation rather than these infections continuing to land people in the hospital. And in fact, even though we had gotten down to 6,000 hospitalizations or so per week for much of the month of June and July, we are now unfortunately over 10,000 hospitalizations per week. So this is definitely heading in the wrong direction. Now, taking a look at emergency department visits, this is the percentage of all emergency department visits with diagnosed COVID-19 in the United States. And we can see that this upslope is also continuing. And these data are actually the most updated out of all of them. This graph reflects a 7-day moving average as of August 11th. So certainly we do not like to see emergency department visits going straight up like this. I know I will feel a lot better when I start to see this plateau or head back down. And when we take a look at this broken down by age group, unfortunately, we see that emergency department visits are increasing in literally every single age group for or with COVID. And let's keep in mind that it's much more unusual in general for a child to have to go to the hospital or emergency department at all. So in general, we think that an even larger proportion of the child emergency department visits could truly be from COVID rather than just with COVID incidentally. And as a reminder, there is no more routine COVID screening happening. So these tests are usually only occurring in the event that there's some symptom that would lead to the test getting done. And frankly, sometimes not even then from what we're hearing. So what all of this means is that increases in emergency department visits, particularly across all age groups like this, is particularly concerning at this stage. I think it means we don't quite have the handle on things we may want to believe. So to recap where we are so far, we have increases being demonstrated in wastewater, as well as test percent positivity. So from this, we know that there's more COVID circulating. There are more cases happening around us, and this means more people are getting sick, missing school, missing work, and some percentage of those people will end up with long COVID or post-COVID events. But it's more than that. We're also seeing increased emergency department visits across all age groups. We're seeing increases in hospitalization, and we certainly do not like to see this because this means that the increases of COVID cases are translating into our healthcare delivery system. We know that something has gotten these individuals sick enough to go to the emergency room or to the hospital. And as I said, these days tests are typically not being done unless there's an indication for it, and sometimes not even then. So while we know that some people will be in the hospital primarily for COVID and others will have it as a compounding factor, we see that these indicators are both just heading in the wrong direction. So with all of these indicators taken together, we can see that we are having a summertime increase or surge or spike or uptick or whatever we're going to be calling it. In fact, our increasing hospitalizations have been a trend for the last few weeks already. And for the week ending August 5th, it's even a bigger increase than the week before, which was a bigger increase compared to the week before. This was actually a 14.3% increase in hospitalizations for or with COVID for the week ending August 5th. Now, what about deaths? So deaths had been decreasing every single week since late February when we were at about 2,000 deaths per week, and it had been going down weekly ever since then. But for the past month or so, it has been just under 500 per week and kind of staying there, but declining a little bit. But unfortunately, the week ending August 5th, that trend reversed, and we are showing the first uptick compared with the week before since late February. And in fact, there was a 10% increase in the number of deaths due to COVID the week ending August 5th. And remember, when it comes to deaths, this is probably one of the most reliable metrics we have. If COVID shows up on the death certificate, it means that COVID was either the underlying cause of death, which has been the case 87% of the time, or a contributing cause of death, which has accounted for the other 13% of the time. Either way, we know that a COVID infection certainly did not help, but in any case, 87% of the time, COVID was indeed that main underlying cause of death. Now, since hospitalizations have been increasing for the past few weeks, this is not really a surprise that deaths are going back up. In fact, increases in deaths have followed increases in hospitalizations by several weeks for almost the whole entire pandemic. So we should be prepared to see this continue to increase, trailing behind those increases in hospitalizations, which, as we've said, continue to increase at a troubling rate. Now let's take a look at variant proportion. So this is the exact same as what I showed last week, since this is only being updated by the CDC every 2 weeks. We are currently dealing with all XBB subvariants of Omicron. EG.5 is increasing at a pretty, so it does have some kind of advantage over its relatives, the other XBBs. And remember, EG5 is another name for XBB.1.9.2.5. So it's still an XBB, but luckily it's not so different from the other XBBs, and we expect that it will be covered by the fall booster, which is reportedly going to be against XBB.1.5. So then why should we even care about the different variants? Well, I do think it's helpful as a reminder that we are still in an evolving situation with SARS-CoV-2. The virus continues to be transmitted at high rates, as we've covered here today. And as a result, it has plenty of opportunities to mutate. So it's important for us to keep tabs on this evolution so that we'll have advance notice if and when the next Greek alphabet letter comes up. We've been with Omicron for a while now, but there's certainly no guarantee that we stay in the Omicron family, particularly because we have not been able to effectively slow down transmission. Now, there are several labs that are doing amazing work and are really contributing to our knowledge base, really the entire world, about how SARS-CoV-2 is evolving. We have samples being collected from patients that may get sequenced. There's also capability to sequence from the wastewater. And this is happening at some fantastic labs actually in different parts of the world. So with all of that being said, we don't have a clear reason to be particularly worried about any of the main variants that are circulating here now, but this isn't something we can just stop looking at. Each new variant or subvariant that has an advantage over its predecessors is at least something of a concern, because it means it will be spreading more and more. And with every transmission, once again, that's another opportunity for it to either mutate or do some recombining with another strain and basically just evolve to avoid the immunity that we have acquired either through infection or vaccination. So every time a new variant makes it on the scene, I'm looking towards those labs that have really been doing this incredible work throughout the pandemic to see if there's anything in particular we might want to keep an eye on. This is not so that everyone can get excited about every single new variant. This is just one of the ways that we can keep tabs on the pandemic in addition to the other metrics that I reviewed today. So notice I am still referring to the pandemic in present tense, but are we still in a pandemic or not? There's definitely a lot of confusion about this, and understandably so. The World Health Organization has said that they are hopeful that we will be able to declare an end to the pandemic in 2023. But in their June meeting, they discussed that although COVID is no longer defined as a public health emergency of international concern, it is still a pandemic, and we are now in our 4th year of this pandemic. And so you'll notice that depending on who you ask or what materials you read, that some continue to refer to our situation as a pandemic and others say that we are entering an endemic phase. And at the end of the day, these are pieces of terminology that really don't have a cutoff or a threshold or a number we can look at to decide. There are many people who are still referring to it as a pandemic because we're still not able to control or predict the amount of sickness or hospitalization or death that we are experiencing. So this is very different from, for example, the flu, which is endemic, where it is rather predictable as to how many people will get it, who will get it and do poorly with it, who's going to have those severe outcomes. And we're really not there with COVID. We've been pretty much chasing behind it. So even though it's true that we're certainly doing much better than we were before, that doesn't make it predictable. That doesn't make it so that we know when the next wave is coming or the next variant that could evade some of our prior immunity, or when we'll get another big surge, because it is still very much evolving. And even with the flu, we know that we can have epidemics or pandemics on top of kind of being endemic. So all that to say, it's actually not necessarily a good thing if we're saying we're out of the pandemic and into an endemic state, because either way, we're still dealing with COVID circulating in our environment, and it is still wreaking havoc, whether you are going to call it pandemic or endemic. So I am not an epidemiologist. I am not going to sit here and make a big claim or decision about it here. I am here to tell you that it kind of doesn't matter which you want to call it. It is still about assessing our risk to the best of our ability and doing the best that we can to mitigate it. So people are definitely asking kind of along these lines, is this just how it's going to be from now on? People getting COVID multiple times a year, a certain percentage of those people suffering from long-term consequences, continued weekly hospitalizations and deaths. And I personally don't feel comfortable answering this question because I'm seeing so much changing and evolving. COVID is changing and evolving, but also we're changing. We're learning more things every single day. And I do feel hopeful that we are going to learn more about long COVID and post-COVID events, and that could change things significantly because many people are not necessarily worried about death from the acute phase of COVID, although that is a real danger and a real risk for some portion of the population. But I think most people who've been paying attention are concerned about the potential for these long COVID and post-COVID impacts. I am hopeful about better vaccines in the future that can hopefully significantly reduce transmission because we don't have that now, and it could really be a game changer. Last week, I reviewed one pan-sarbecovirus antibody that holds promise for a vaccine or treatment in the future. And there are, of course, many other innovations being worked on that I think should give us reason for hope. And there's a lot of research and study going on long COVID. And even though I know I have expressed that it feels like it's going very slowly and we haven't had any real treatments or breakthroughs yet, there's a lot going on and we are improving our understanding every day, which means it's really just a matter of time before we will be able to find a way to hopefully identify, prevent, or at least treat long COVID and post-COVID events. Now, I am disappointed in several things I believe should have been put in place and have not been put into place. The list is probably pretty long. I'll just highlight a few. First of all, I would say installing excellent ventilation systems at all of our schools and other venues to improve indoor air quality and reduce transmission indoors. This could make a humongous difference, and it's frustrating that we haven't seen this happen yet. Another thing would be some type of federal sick leave policy, and frankly, even more than that, just a change in our culture that seems to value people showing up to work and school sick. This is completely counterproductive to society in general, and of course to the individuals who are sick and those who they come in contact with. And it's really kind of disturbing that this seems to be our normal culture and that people can't get the time that they need to actually heal and rest and recover. And I had really hoped that this would change for the better during this crisis, but I am concerned because it really does not seem like it has. I would have also liked to see free N95s, KN95 masks, and continued free rapid tests for all who want them, because this is a collective problem, whether we would like to admit it or not, and it would really benefit from a collective solution. I think our individualism and turning our back on many aspects of public health is pretty disheartening. But I am still hopeful that at some point in the future, we will have the ability to reduce transmission. I'm hopeful that sometime in the future, we'll know how to prevent and treat long COVID and post-COVID events. And I'm hopeful that more people who are at risk will avail themselves of outpatient treatment instead of ending up in the hospital or even dying from something that we can oftentimes successfully treat as an outpatient. But we have to do it in time. A reminder of those treatments is here. Paxlovid is going to be the treatment of choice for most people. Needs to be started within 5 days, but we also have a couple of other choices here. Remdesivir, if you can get it, it's IV 3 days in a row, and it is actually approved for all ages. So if you are someone in a high risk category, and can't take Paxlovid for some reason, or you're under 12 years of age, this would be the treatment of choice. But I would highly recommend getting a plan for how you access this ahead of time, because this has been, unfortunately, a big challenge. And last and least is the molnupiravir. Rather than cutting your risk by 80 to 90%, like the first two choices, it's going to reduce your risk by about 30%, but that's definitely better than 0%. And then the high titer convalescent plasma is really for folks who are immunocompromised. And once again, this is something where you're going to need a treatment plan in advance. So in summary, all of our indicators, all of them now, are continuing to point to an increase in COVID affecting us right now. Wastewater, percent positivity, emergency department visits, hospitalizations, and now deaths are all heading up. And none of these indicators yet are showing slowing down or leveling off yet. In the short term, we are anticipating an updated booster and instructions on who is going to be recommended to receive it for the fall. In the longer term, there is important research happening, especially in the area of long COVID. There are hopeful innovations on the horizon that could really change things, like a vaccine that could stop or significantly reduce transmission. And in the meantime, we should still be doing what we can to avoid infection and reinfection. And of course, this is getting more difficult as people seem to be choosing to drop protection measures, despite the fact that COVID is still very much with us and we don't want to keep getting it over and over and over again. Dropping these precautions is not advisable when there seem to be cumulative effects of repeat infection, and there doesn't seem to be any limit to the number of times you can catch COVID. People are catching it even every few months. There's still a lot we don't know. We have a lot to learn. We're still learning about the effects of repeat infections. We're still learning about post-COVID events and long COVID. What we do know is that following COVID, we are seeing increased risk of new onset diabetes. We're seeing worsening diabetes for people who had it before. We're seeing blood clots, heart attacks, strokes. We're seeing memory issues. We're seeing new asthma or worsening asthma. This stuff isn't happening in everyone, but we still can't predict who it's going to happen to. We also know that if you caught COVID once and did fine, that is not a guarantee about the next time. Sometimes repeat infection can even be more severe, even in that acute phase. And also, every infection is a new opportunity and perhaps even a compounded opportunity for long COVID and post-COVID impacts. So please do what you can to avoid getting infected or reinfected and avoid spreading it to others. Let's keep up our best practices to prevent the spread of COVID and prevent outbreaks. Let's stay up to date on vaccination. Wear a high quality filtration mask like an N95, a KN95, or a KF94, especially if you're indoors with others. Make sure you've got good ventilation and filtration if you need to be indoors, which you can access with a CO2 monitor. Limit your time indoors and the amount of mixing that you're doing, and whenever possible, gather outside. And again, if you're someone who should be treated if you catch COVID, then you should know that in advance and you should have a treatment plan. And starting treatment on time means testing on time. So know where you can get tested. Keep antigen tests on hand if you can. Check with your insurance, see if they are covered. Many of the plans are still covering rapid tests. You may be able to get a couple of them a month. So please look into that. If you don't feel well, please stay home and rest and don't spread what you got to others. If you do test positive for COVID, please test out of isolation. Test negative before you go back around others. In general, enough virus to detect is enough to infect. And if you don't have a primary care provider, please get one. Know how to reach them before you need them. And remember to eat a balanced diet, incorporate fruits and vegetables and whole grains, avoid those sugary drinks, get outside, get some fresh air, but stay hydrated and be careful in this heat. Consider a multivitamin supplement, get your blood pressure and baseline labs checked, like your sugar, your cholesterol, your vitamin D. Get some regular physical activity unless you are sick. In that case, please do get your rest. Manage your stress levels and get a good night's sleep. This concludes today's People's Health Briefing. Thank you so much for joining us, and we'll see you again next Tuesday at 10 a.m.